Welcome back to On the Beat, everyone. Isaac here hosting this week. And today I have with me Krystal Murray from Baptist Medical Group, Columbus Children's Clinic. Krystal, thanks for spending some of your morning with us today.
Thanks for having me.
Sure. So the cardinal sin in medicine, you get a medicine and maybe you start feeling better and you don't take it, and then you get something else down the line. You know, I'm just going to use the same medicine. So it kind of gets us started here. We're talking about antibiotics. What is the harm in taking one without a bacterial infection?
Well, there's multiple things. We have good bacteria and bad bacteria that live in our bodies.
Okay.
And so if we're taking an antibiotic and we don't have any bad bacteria to kill, then we're messing with the normal flora that's in our body that helps us to fight off infections and get us to feeling better.
Sure.
So not only could you prolong your current illness, you can cause other infections, and you can also cause resistance to antibiotics.
Okay. So kind of, we know that antibiotics treat bacterial infections. So say you have one, but what is the difference between that and just a virus, a run-of-the-mill virus?
Viruses your body has to fight off
Naturally.
Naturally, yes,
Okay.
by itself. So you want to support your body in doing that by
Sure.
drinking lots of fluids and helping your body flush that virus out.
That would be the normal or the good bacteria in your body already sort of fighting that virus off?
It can, yes.
Okay.
Yeah, your immune system's helping to fight that.
Okay. Whereas a bacterial infection needs an antibiotic's help.
Yes,
Okay.
exactly.
All right. So parents at home, what would they do to avoid using them when they're not really needed? Like, how can you tell the difference when is it a cold or is it something else that maybe is a little bit stronger?
So it's not the color of your snot. A
Okay.
lot of people growing up were told, myself included, that if you have green snot, that means you need an antibiotic.
Yeah, and that means you're sick as a dog, and
Right,
it's just
and that's
okay.
not true. That's our normal course of our body fighting off viral infection. Usually
Sure.
around day 3 to 5 of you having symptoms, your snot will kind of get some color to it, and it'll stay that way for a couple days. Usually that's when you go to the doctor and they give you an antibiotic. Your body was going to get better in a couple days anyways. You feel like that antibiotic made you better.
Sure.
If you've had symptoms for less than a week, it's very unlikely that you had a bacterial infection at that point.
Okay. So say you have a virus, which I guess is a cold, right?
Yeah.
A cold is a virus. Okay. So how should we manage that? Because we don't need to necessarily treat it with an antibiotic, I guess.
Drinking lots of anything you can to help your body flush it out. So drinking lots of fluids to help thin that mucus, running a humidifier in the room with you, taking steamy
So a
showers.
humidifier, not a dehumidifier.
Right, cool
Okay.
mist humidifier would be
All right.
best.
That's good to know because I feel like sometimes gravitate toward dehumidifying things.
Yeah, you want to moisten that airway and thin that mucus out as much as you can.
All right, so say you're trying to best practices. So say you're a healthy person and we're not trying to fight off a virus currently. What should we do, kids, adults, all the same? What should we do to prevent a cold from getting to us?
That's real hard to do, especially to move around in public.
Sure.
Kids get up to 12 colds in a year.
Okay.
So it seems like they're sick all the time, especially the younger they are, because their immune system has to build up that immunity. But keeping your hands washed, staying up to date on vaccines, making sure you're around other people that are covering their coughs.
All right, well, you heard it here first from the expert, Krystal. We sure appreciate you spending some of your morning with us, some good tips in there. And if you need additional information, you can find it there listed on your screen. We'll be right back.